Welcome to On the Story. I'm Lynn Smith.
I'm Michael Lanos, and Lynn, we're going to continue with our exclusive interview with Dr. Boutte on a day where there's breaking news concerning the doctor. Her medical license in the state of Georgia has been suspended. And there she is. Many know her as the dancing doctor, dancing, singing during procedures. And she'll talk about that. But we want to get you the breaking news information. This is the Georgia Composite Medical Board handing down that ruling today. And here's what they said in their ruling, that respondents' continued practice, that's Dr. Boutte's continued practice of medicine, poses a threat to the public health, safety, and welfare, and imperatively requires emergency action, and hereby orders that Dr. Boutte's license to practice medicine in the state of Georgia be and is hereby summarily suspended. So there's the breaking news. And from what we gather, 7 different incidents are mentioned. One just a week ago. A woman went in, this was May 30th, for liposuction, breast augmentation, and a butt lift. The next day she goes back for a post-operative visit and does not see Dr. Boutte, sees somebody else. Then later that day, it's about 9 o'clock that night, she has breathing issues. She's bleeding from some of the liposuction incisions. So she is taken to the hospital. When she goes to the hospital, it's found that she has a collapsed lung. She's suffering from anemia due to blood loss, and she's still in the hospital, by the way. I mentioned 7 different incidents mentioned in all. Another one from February of 2016, a sad case where a woman was in surgery for 8 hours, ends up in cardiac arrest, has brain damage. The other cases are from 2014, 15, and 16. And here's the theme with all of them, that the diagnosis, treatment, and record keeping from Dr. Boutte's office failed minimal standards. We've reached out to Dr. Boutte after this breaking news. No comment as of yet. We'll keep trying on that front. So while this breaking news is happening, we are hearing from Dr. Boutte, who wanted to speak to us and tell her side of the story on a number of different topics. And what we're going to focus on now are the videos, because that's what grabs our attention. And there's a real back and forth. Did patients consent to this or not? Dr. Boutte says yes. Some of the patients says, no, I did not. Here's a back and forth. At least part of this section is a back and forth with one of those patients. Here it is, Dr. Boutte in her own words. So the one woman I saw, her name's Latoya Arsheen. She said she saw the video as somebody was reporting, one of the affiliates was reporting on it. And she says she wasn't happy.
That's you. That's you on the operating table. Did you ever give consent to be videotaped like that?
No, ma'am.
How do you feel about this, Latoya? How do you feel about the fact that your surgeon and your surgery are being featured publicly in this manner?
Horrible. Disrespected. Humiliated.
Can I ask you how the surgery turned out?
Horrible. I'm disfigured.
So did she consent to have that?
She did.
You say she did?
Yes.
So you guys disagree. She says she didn't, you say she did.
Correct.
Okay. Verbally, or did she actually sign it?
Both.
Both.
And after the post of the infamous video, we have her text message exchanges, because I'm often texting my patients just to make sure they're okay afterwards and before if they have any questions. And I say, hey, did you see it? I posted it yesterday. And her response was, Dr. Boutte, that was the perfect song, and you're a beast at what you do, and you changed my life.
What about the voicemail back and forth where you want her to do a testimonial? She says, no, I'm messed up.
And that's where I got confused, because let's just say maybe about 6 or 7 months after her first, she said she was very happy, but let's just say wanted me to do more work.
The favor that I wanted from you, you ready?
Uh-huh.
I wanted you to send me like a 1-minute video, if you're game, and even if you don't want your face shown, then that's fine. But to say, you know, hey, and they coined me, this is another thing that worked in my favor, they called me the dancing doctor. Now, you know, millennials love that. So my social media followers have grown exponentially since the story broke. Everybody loves a dancing doctor, right? People come to me from everywhere because they know the result.
Right.
And so in your video, I wanted you to say something like, hey, I'm the girl in the video, the cut it video. for the dancing doctor, Dr. Boutte. I'm going to use that term that they coined me. I'm going to use it against them. You know what I'm saying?
Mm-hmm.
You following me?
I'm following
Do
you.
you think you want to do it? Do you think you want to do it?
I don't know, because I'm really messed up, Dr. Boutte.
What you're saying, she was happy, wanted a return engagement. What I'm seeing and what others are seeing that's seen the reporting saying, she's not happy at all.
Mm-hmm. Well, can I use the word, sometimes we want to be heard, we want to be seen, and sometimes it may not even be exactly the factual what we're saying, but we just want to be seen.
Okay. So that back and forth will continue, I'm sure. And you're ready to stand your ground.
Absolutely.
Yeah. In looking at the videos, and again, this is widely reported, so medical experts are going to weigh in. When they see the videos during a procedure, some of the quotes are, "This is unprofessional, dangerous," and this is from medical experts. You're showing a lack of concern for your patients. Your rebuttal to that?
Again, these videos are consented, and it is pre-discussed with the patients at what safe interval that a 30 to 60-second video can be shot. Mostly, I would say 98% of them are in the post-operative period, in the recovery period. And the patients, I've had instances, let me just put it this way. The patient chose her song, Doing the Butt, let's say, Doing the Butt. And during the 30 to 60 seconds, the patient loves that song, that's why she chose it. And I'm telling them, look, you got to be still, I'm going to shoot your 30 seconds, because they're aware of what's going on here. And so I'm like, you got to stay still so I can shoot this, and this is about the art of what you've achieved, the transformation, right, our celebration. Well, I've had patients to dance on the table with the song because that's their song, and they want to celebrate that. And I would just say, no, you have to stay still. So it's under safe, controlled circumstances, consented circumstances, 30 to 60 seconds, where no harm was done, no issues with infections, anything like that, your average standard risks and complications, none of that at all whatsoever.
Looking back, do you ever say to yourself, well, maybe we shouldn't have gone there? It's opened up some trouble.
That's an excellent question. Had I had the forethought and the foresight that an entity could take those innocent, consented, educational and celebratory videos, misconstrue them, edit and fabricate the context, and use it for negative agendas, I would not have done it.
Got it. Because the math has gone against you in the sense of, here's the videos, and now you've got numerous complaints, this according to attorneys. It says, the doctor's not taking care of me. She's more worried about dancing and singing than this procedure. I'm
passionate about with the patient. We're celebrating and educating on what can be, how transformations can actually happen in my hands. I totally understand the signs of taking. I'm a board-certified dermatologist and dermatological surgeon, 24 years if you include my practice, my time of residency at Emory University, 28 if you include the science research I did on skin at UCLA School of Medicine, okay? So I'm very, very confident at fat grafting and liposuction and all the mechanics of what happens to the skin during surgery and in the healing process. So I'm well adept, I'm very well educated about what I do, and I'm very competent, and I'm good at what I do. So to use the videos that were supposed to be a happy, educational, inspiring, anxiety-relieving, celebratory event for the entity's negative agenda is totally wrong. Because the patients and I know the context. The patients involved. We know the context. But, what I've learned is that anything in social media can be edited, can be, can just be misconstrued, misrepresented for a negative agenda. And the videos had nothing to do with that it was a happy time.
Did you
for
ever
these
have that
patients.
conversation with your staff and just go, I don't know, did anybody ever raise the red flag? This could be misconstrued. Doctor, you could be perceived as just being careless, or some of those terms that other medical experts have used.
No, in fact, you know, the feedback that we got from patients, that's, to me and my staff, was most important. You know, my staff is amazing, and they're excellent, and they're insightful, and they keep patient safety first at all times. They would have said something if they said, you know, well, you know, this is not the environment, or, you know, because we cleaned the skin, we, you know, kind of dressed around it, you know, and so we know there's no chance of anything untoward happening, right? And the feedback from the patients, as I said, when they saw the videos, they came in requesting and consenting to do videos. People that didn't win the contest, because it started out with a contest, remember?
So you're saying you gained patients?
Oh, yeah.
With the videos on YouTube, you gained more than you lost.
A plethora. And the responses on, the comments on my Instagram page, Boutte by Boutte, they were like, hey, Dr. Boutte, that was a dope video. That was boss. Can you do I want this song when you do my transformation, because I know your work is going to be amazing. Let's celebrate with my song.
And nobody ever said, I was going to go to you, but I saw the videos, and I was like,
Never,
no.
ever, ever.
Interesting perspective there. We'll hear more from Dr. Boutte in a moment. I want to be clear here. The breaking news today is that Dr. Boutte, her medical license in the state of Georgia has been suspended. The videos do not have anything to do with that. This is seven separate cases. But I will say this, Lynn, as we listen again, some of, I believe, what we're hearing in our interview today, and we'll hear more a little bit later, is what I think she's going to say to the medical board as she tries to defend herself.